So Tina and I have decided to brave our fears of hospitals for you. We're here at the University of Washington School of Medicine. But really, Tina, in terms of medical technology, this place is the forerunner.
Yeah, they've got a lot of really cool stuff, especially if you're a resident and you're going through the process of becoming a surgeon. They have a lot of simulation stuff so that, guess what, you and I don't have to be dummies on the operating table.
That's right. So we want to go inside and see what sort of software, technology, robotics these students here at the University of Washington are learning in order to become better surgeons and doctors.
I'm going to go.
I'll go with you.
So here we are at the University of Washington. I've got Dr. Ross, Dr. Kryman, and Dr. Becker over here, and Chris, who's going to help us out. And Dr. Ross, tell me a little bit about what you do here at the hospital and what situation we're in here.
Right. We're in the Department of Anesthesiology, and we drift people off to sleep so they can have surgery. And in fact, I get paid to wake them up. We're in the sim lab, which is a virtual operating room. Yeah. It's a room set up much like an operating room, and here we can teach residents how to manage events, critical events that may happen to their patients during the surgery that they may never see in their training, or are pretty catastrophic events, and they need to really know how to manage them.
Because this is not your typical mannequin. I mean,
there's
a lot more than lungs.
Let me tell you about it.
Yeah, please.
Okay? I don't know if you can tell, but he's breathing, so his chest is moving up and down. And if you put your hand over his mouth, you should be able to feel him breathing out. If you feel in his neck, right here, once you can feel the pulses in his neck.
God, that's
okay,
wild.
and we feel down on the wrist down here, and he has pulses in his wrist.
I mean, Chris is technically a robot, just a reactionary robot.
Exactly.
He's going to be able to react based on how I do.
Yep.
So I can kill him okay.
Yeah,
okay.
But if you do, you can't charge for it.
We can't charge for it.
Sam, tell us what we're seeing on the screen right now.
So basically, this program right here is running the mannequin that's next door.
So you control everything that the body goes through.
Exactly. We control its breathing rate.
You
can see his lungs going up and down right here. This is his blood pressure right here.
And this is all accurate and in real time?
Real time. It shows on the monitor up here.
So what sort of health crises can you give the mannequin? Like, can he have a heart attack?
Anything you can imagine. Heart attacks. For example, today we'll probably do like a hardware removal for broken ankle.
Is this controlling the camera?
Exactly. So we have camera in there, we have a speaker, a microphone overhead that we can actually control with this. So this actually moves it around.
Oh, look, so you can see the whole room. So like the little eye in the sky.
Exactly.
Little big brother going on. And then you can talk to them in the other room as well.
Exactly. Through a little transmitter, and there's a speaker right next to the head.
All right, let's put it to the test. Let's give the dummy some, the mannequin. Let's give him some heart failure.
So let me tell you about it. We're going to do an anesthetic here. You're going to be our anesthesiologist for the day.
Okay.
And you're going to be our capable assistant. And we'll have 2 other young docs here making sure that you are a capable assistant. And over here we have an anesthesia machine. And this anesthesia machine, after we drift him off to sleep, we are going to have to put a special little breathing tube in. And this will go into his trachea, which carries the air from his mouth into his lungs. Chris is a young man, 25 years old, was out rollerblading, busted his ankle a couple years ago. They plated it. Now the plates are hurting his foot. Okay. And so we're just going to take it out since the fracture's healed.
Hi, Chris. I'm Dr. Wood. Thanks for coming in. But we're going to take really good care of you today. I don't want you to worry about anything, okay?
I hope so.
Okay.
I'm nervous here.
I could do this blindfolded, but I won't.
All right.
Okay, here we go.
Okay.
So the first thing we're going to do is have him start breathing some oxygen, and then we're going to hold this mask on the patient right here.
So he can see that he's awake.
Yeah, he's awake.
Yeah.
Just hold it nice and gently. We'll ask him to take some nice big breaths. She's turned that stopcock.
Okay.
And Chris, you're going to get nice and sleepy now. It may sting just a little bit, Chris, but it'll be over in a second.
All right.
We're going to hook on this drug that's going to paralyze him.
Okay. But is he?
Not yet.
Okay.
So we're going to make sure he's asleep, because having somebody paralyzed and awake is not a good thing. See how his lungs are going up and down? Do another squeeze.
Oh yeah. Okay. So now we got
now
him.
let off. And then squeeze again. Not quite so far.
Okay.
Lift up, and then can you see the tube way back there? In there?
I do.
Okay, put that breathing tube in. Can you still see where you got to go?
Yeah.
Okay, put that in there. Shove it in a ways.
Okay.
Is it in a ways? Perfect.
Okay, this goes on here?
Right on there. Good. And you hold it there.
Okay.
And then squeeze back that bag over here and see if its chest goes up and down. Oh, perfect. Let's open the bag up so it doesn't get too inflated. We're going to tape this tube, so now grab it up here.
Okay.
And I'll tape this in, because you don't want this to come out. If this comes out, it's nighty-night. This is the thing that's going to keep him alive. We're going to put this little bite guard in here. And so put that down like that and twist it around now. His heart rate's 74. His pulse is saturation is 100, and his pressure is 112/72. Was 120/72. That's good. So he's doing pretty good, I think, right now.
They have no idea what sort of catastrophes are coming their way in terms of this mannequin's health.
Exactly. They don't know this yet.
Yeah.
But we're going to put him into VFib, which is basically a heart attack.
Okay.
This house is waiting with him.
Yeah.
And then push this button, it'll switch. So his heart, his EKG and his heart will stop.
Oh, okay. They better be paying attention.
Yeah.
I am sweating.
Now, have you noticed anything funny? Did you ever hear, were you hearing some kind of rhythmic thing that you're not hearing now? That beep, beep, beep of his heart.
Oh, yeah. What happened to his heart? Oh, no, wait.
Oh, my God, it stopped.
Oh, my God.
So reach down here and see if he's got a pulse.
Okay.
I got to start CPR.
Okay.
And then, Dr. Kryman, can you get some
We still don't have a heart rate.
epinephrine
Heartbeat.
ready for her? I want you to help him get that
Okay.
epinephrine ready. We're ready for the
Just going to go into the
defibrillator.
IV?
Go ahead and shock.
Nothing.
Paddles back.
Okay.
Start CPR. Can you give us some?
Yeah.
Ever give adrenaline?
And where do this
An
is going to
epinephrine,
go?
a milligram of epinephrine. Okay, have it set at 360
Okay.
still.
Okay.
Bang that in.
And what's this going to do?
That's gonna hopefully increase his blood pressure so we can
Okay.
get his heart started again. So we give
Okay.
him some adrenaline.
Okay.
Now, do you have to give him back his heart? Just whatever.
So I have it waiting with him right now. So when it's time, I'll flip it again.
I gotcha.
Paddles up. Okay, set at 360.
I'm clear.
Okay, charging at 360. I'm clear, you're clear, we're all clear. Shock. Oh, yeah, no, good. We got
Oh, we got him. We got him. We got him.
Do we have a pulse?
Okay. Yes, we got a
Oh,
pulse.
we got a pulse.
It's
Got a
beating
pulse now.
fast, but we got it.
I wonder why it's beating so fast.
Jeez.
Because we gave him a whole bunch
Oh
of
my
adrenaline.
God.
That's why it's beating so fast,
We just-
okay? Well, we won't have to call him up, but his heart's beating fast for a while.
I'm so... I'm
Why
a
do you-
nervous wreck.
10 years ago, you would have been an anesthesia resident. Your first day, you would have been doing a live patient for the first time, and that could have happened. Do you think you would be better prepared, having done this a couple times, before you see your first patient?
Oh, yeah.
That's
I can't
the
even...
idea.
it would be horrifying. I mean, it's like... Yeah, I don't know.
Yeah.
I'm speechless. I really am. It was so intense, and it just what a difference that having something like this makes. Well, thank you very much for
Well, you did
letting
a
us
very
come
good
in.
job.
That was.
You stuck right with it.
I feel like we should all group hug or something.
Really, you did a good job.
So I kind of freaked out a little bit in the virtual OR. Dr. Ross,
Yeah,
told me
high
to grab.
pressure.
It was
Stressful.
But that's the idea of the simulation, is to make it as realistic as possible. And UW here, the School of Medicine, they have so much that we couldn't get it all into one day. Tomorrow we're going to show them some more stuff, right?
Absolutely. Tomorrow we'll do some more virtual simulations and surgery.
So make sure you tune in.
Come back.
See you tomorrow.